Hi, my name is Cindy Wolf, and I'm a veterinarian who has been lucky enough to work with sheep and goats for much of my career. I also farm with my husband. We have a flock of commercial, primarily whiteface wool and hair sheep crosses, and also have a smaller flock of composite terminal sires. And then we also have a cow-calf operation. Thank you for inviting me to speak with the Missouri sheep folks. And I'm going to start sharing my screen and get right into my presentation. Okay. We're going to talk about some tips that I have been taught and also learned over time with lambing ewes in confinement and also out on grass. Used to work for the University of Minnesota College of Veterinary Medicine, teaching veterinary students how to hopefully be good sheep and goat veterinarians. I did that for a couple of decades, and now I'm here at our home farm much of the time, and also still work with a handful of clients who have sheep and goats. One thing that we're all taught, and maybe sometimes easy to not fully realize the importance, is body condition scoring our sheep prior to breeding, and give yourself enough time to make some changes if we need to get them a little more well conditioned, or if they're too fat, to try to get some condition off, as that can affect implantation negatively. And then somewhere around 6 weeks before lambing, we should also body condition score our flock. And in the ideal world, if we had ewes with really, really big bellies that were a little thin, they would go in their own group, so they didn't have to compete so much with ewes that maybe were carrying singles and twins and in near perfect condition. And this is relevant whether we're lambing in confinement or on grass. So if we have a body condition scoring scale of 1 to 5, the average that we'd like to shoot for, both ahead of breeding and both ahead of lambing, would be somewhere between 3 and 3.5. Some of us utilize fetal number counts when ewes are pregnancy checked by ultrasound, and realize that the accuracy of this very much depends on if the ewes are somewhere between 45 days and 80 days of pregnancy. After 100 days of pregnancy, it's a lot harder to be accurate in your fetal counting. And so why would this matter? As a ewe flock grows in size, it's a good idea to sort ewes by the number of fetuses they're carrying and adjust feed accordingly. Again, it doesn't matter whether we're talking about forage that the ewes are harvesting themselves, or harvested feed that we're delivering to the ewes in confinement. The best feed really needs to go to the ewes that are carrying 3 or more lambs. Many of the problems that we experience as shepherds are really in part due to inappropriate feeding throughout the pregnancy. So I'm going to talk a little bit about this, as well as some management tips. And so I'll highlight it right now because it's easy to see on this slide, but I'm a huge believer in paint branding the families. And you can see these ewes are on grass. They actually do get jugged when they're first born, but they're out by 2 or 3 days of age. And so this lamb I know is a single, because our system is such that any ewe that has a single, the lamb is going to be branded on the left side of its body, and the same for the ewe. If we could find ewe number 34, this lamb's pretty good size, so it's must not be too worried about where its mother is, or maybe that's her right there. She too would be branded on her left side. And that way, let's just say, for example, this ewe developed mastitis, we immediately know what lamb we need to find to bring in and either supplement while we're trying to treat this ewe for mastitis. Ewes that are raising twins, like this ewe right here, they're branded on their right side, and so this might be number 51, and then there might be a 2 written down here below the 51, so I could know that she has lambs 51 and 52. Some people do it a little differently, and there are many ways to achieve the same outcome. And so if the way you're doing it now isn't broke, then don't change it. And then you might say, well, what do you do for you that's raising triplets? Is what we do is we would brand them on the right side, and we'd put a dot up here, and that's just our code that she's raising triplets. We don't have ewes that raise anything more than 3 lambs on grass, and not all our ewes that have triplets can raise their 3 lambs on grass, even with some supplementation, which is what that trough is doing there. That's how they get supplemented, and the lambs learn that grain is an okay thing to eat as well if that's part of your operation. Here's a ewe that's just had her lambs. This is the 3rd or 4th week of May. How do I know that? Because you can see that this pasture had not been grazed. It's kind of beyond its perfect height for sheep quality feed. Not so beyond its perfect height for parasite control, like the higher the grass and the less low down to the soil the ewes graze, the less parasite larvae they'll actually eat. But anyway, so she's just had this set of twins. They look to me like, if they aren't still wet, they were just like an hour ago, and yet we already paint branded them, because they're a lot easier to catch when they're less than a day old, if you want to paint brand or dock or tag or anything like that. What's this mean on her? We call this a blue circle. That's just our system for identifying ewes that have never needed any help from humans. That might be good ones to keep replacement out of, rather than any ewe that's had any kind of problems in her lifetime. Then ideally we don't keep replacements out of those, and they're not what we call blue circle ewes, that you just put your coffee can in some blue paint and mark her, and that mark was put on at breeding and then reapplied ahead of lambing. You can see that she's been sheared just ahead of lambing. Okay, so how much colostrum, whose colostrum, and when? So that's a critical thing. If you're having any kind of baby lamb deaths in the 1st week of life, really criticize or critique your the colostrum that your lambs are getting. And most sheep don't produce so much colostrum that we can make ourselves a frozen storage of colostrum. But if we could, if we did, if we want to, then certainly which ewes ideally would I take it from? Well, I'd probably take it from mature ewes that had a single, because they have extra colostrum. Mature, so they're 2, 3 plus years old, and that means they've been on the farm and had lots of exposure to whatever normal bacteria and viruses might be on your farm. And so they should be good at producing quality colostrum. First-time lambers, as 10-month-old ewe lambs, they maybe don't have quite the quality of colostrum as a 2 or 3 or 4 or 5-year-old ewe. And as I mentioned, the ewe producing a single has extra colostrum that you could freeze it. Some people freeze them in ice cube trays, in which case they're really quick to thaw when we do need to use it. The quality of the colostrum is affected by the body condition of the ewe. So if a ewe is in the last month of pregnancy and she's not getting enough to eat, her body has got to decide between nourishing those fetuses that are in her uterus, making colostrum in her udder, and nourishing herself. And so if she's going to be short or deficient in energy and protein, she maybe won't make good quality and good quantities of colostrum. So that's another reason it's really important to have a good body condition score going into the lambing period. Another reason it's really important is that about 75% of the fetal growth is attained or obtained in the last 30 days of pregnancy. So if we want lambs that are born that are vigorous, get up and find that teat in 15 to 30 minutes, then we need lambs that have been well fed as fetuses. We don't want them ginormous. We don't want them weighing 20 pounds. We want them to be weighing somewhere depending on the breed of sheep or breed cross that you have, is usually going to be somewhere around 7 to 12 pounds is a plenty vigorous lamb. I realize there are some terminal sires that the lambs are a lot bigger than that now, but I'll just talk about sort of non-terminal sires, if you will. The ewe has to be healthy. She has to be able to compete for her feed. She has to be in good level of energy to be able to make good quality colostrum. And also you have to ask yourself, if you're having any baby lamb mortality, have you been harsh enough on your ewe flock? Like ewes that have had lambs die in the first week of life, and we don't think it was our fault or the weather fault and so forth, then maybe we should be culling those low production ewes. When should we vaccinate ewes so that we get ideal colostrum quality? We should vaccinate those ewes around the time that we're going to shear. If we're going to shear about a month before lambing, and usually we give them Clostridium perfringens type C and D and Clostridium tetani, so that's tetanus. And it's not stressful on those ewes as long as you're careful and gentle in your handling. And it's just a vaccine that goes under the skin, so it doesn't hurt them. Again, as long as you're careful in your handling. So I like to keep the ewes fairly snugly enclosed, either in the chute or in a pen, so they can't really wiggle very much when they get their shot. So the shot gets delivered very fast and it's just one poke. Pregnant ewes need to be fed trace mineral iodized salt throughout their pregnancy. And one of the key reasons is they need that iodine to go into the fetus's thyroid gland to help regulate its temperature, to help regulate its growth. And so if you have lambs that are born with big enlargements just behind their jaw, kind of in their top of their throat area, those are goiter lambs that their mothers didn't get a normal amount of iodized salt throughout pregnancy. Again, if everything's going well on your farm, don't consider making these changes. This is me when I was much younger, and this is what we used to do. When every lamb was born, we'd tip the ewe up and we'd strip that little plug out of her teats and have the lamb suckle colostrum from the ewe for just a couple of minutes. And if they've never stood, they're very good at just focusing on suckling. And that was kind of like liquid gold preventative medicine. And we didn't have problems in the lambs. They didn't get pneumonia. They didn't get diarrhea. If we found a ewe with an udder problem, well, then we stayed ahead of allowing a lamb to be short on milk so it didn't starve. So it was just a good system. Now that we're older and our joints hurt more, or maybe not as strong, we don't do this on every sheep. But if we notice an udder that doesn't look right, we try to catch that sheep and make an assessment of the well-being of that family and make a change if we need to, whether that ewe needs to go into a jug or whether that ewe can't raise all the lambs that she has. We just try to decide. Sometimes those ewes just have a lot of milk and too big a teat for pasture lambing, in which case we try to milk those ewes down and help those lambs keep up with that milk production until they get more vigorous. If you do jug your sheep, I'm a big believer that we recognize that in the US, we've been making our sheep, it seems like, bigger every decade. And so that we make our jugs big enough so that these ewes can turn around without injuring their lambs. It's nice to use some sort of jugs that we can see into them very easily, so we don't just pick up the junk plywood out of dumpsters. I like to use something that it's very easy to see the well-being of the family. It's easy to open them up, to clean them out. In a perfect barn, you would clean them out in between families, and that way you'd keep the level of bacteria way down such that the lambs can stay healthier. And then there are systems such as developed by the Pipestone system, where people take large PVC pipe, it's capped on either end, and cut out a hole big enough for a ewe's mouth to get in, but we raise it high enough that ideally they can't poop in there. And we fill that with water every couple days, and that reduces the labor necessary for watering ewes in jugs, because you can just attach the hose and fill it up every couple days versus passing water buckets or filling water buckets on a daily basis. It's not very often on our farm that we have a lamb that, if we did use a water bucket, that a lamb ends up in a water bucket and drowns. But it's an occasional thing that happens more often if we put the wrong lambs in with the wrong ewe in a jug, and the ewe kept bouncing that lamb around, and we weren't paying good attention and didn't realize that lamb wasn't being loved. And next thing you know, if it ended up in too big a water bucket, it's going to drown before it can get out. Okay. We've all had the experience where we've had lambs born that maybe it was a bit of a difficult lambing, and these lambs were born with a heartbeat, but they just didn't seem like they could take their own breaths. And so there are a couple things a person can do in that situation. We can take a clean stomach tube and pass it down the lamb and stop about mid-neck. The lamb's laying on its side. For me, I like the lamb to lay on its right side, so the left side of the lamb is up. And I take my left hand and I pinch off right in front of the tube. So the tube would end right here. And I take my left hand and I pinch off below the tube. Then I take my right hand and I will close off the mouth and the nose, and I'll actually have this tube in in between my teeth, and I'll blow air into the tube. And you'll be like, what? Why is she doing that? You don't have it in the trachea, you have it in the esophagus. And yes, that's correct. But I'm not allowing this air to go down to the stomach. I've got it pinched off. And so the air comes out the end of the tube, goes back up into the mouth, and then goes down the trachea right here to the lungs. And you just see the chest rise a little bit, and then let your hand go. I use my right hand here in spite of the drawing, because that's my more dominant hand, and that's a little harder to do than it is this side, but it's whichever you prefer. And then the air comes back out of the lamb, and then I close off the mouth and nose and breathe again for this lamb. And I'll do that probably, I bet I do it a couple of minutes. And usually I get enough oxygen into this lamb that then it can start breathing itself. Now, what if we have a lamb that is trying to breathe, but not breathing that well? Okay, so this lamb here was a lamb that just the heart beating, but no breaths by itself. This is a lamb, heart beating strong. It's trying to breathe, but I'm not convinced it's breathing regularly and often enough. Well, right here is this, what we call a seam, also called the philtrum of the lamb. And you just take whatever you have handy. If you have a pen or a pencil, anything with a sharp point. If you had a screw, if you had a needle, we just put pressure there with our sharp point. We don't necessarily even have to stick it into the skin. We just apply pressure, and then we twirl whatever it is we're applying pressure with. So let's say we're using a pen. We just push it against there to indent that skin right on that seam or that line and twirl it. And that's an acupressure point that stimulates breathing. And does it work? Yeah, it's pretty darn helpful. It's not going to save every lamb, but it can be very helpful. And usually when we find these lambs, usually we all have some sort of something in our pocket because we're farmers, right? That has a sharp point that we can use because these are not planned events. Okay, so if we're going to lamb inside, it's very advantageous given enough feed and the right type of building to shear these ewes ahead of lambing. The only times I would not do this is if they were too thin or the building was barely a windbreak and it was going to be extremely cold outside. But the rest of the time, if we managed everything well, and I thought the ewes were close to body condition score 3 or higher, I had them on a good level of nutrition, and I had some nice dry bedding, and I could keep the building a little warmed up because of the number of animals in there, and some construction changes, then I would shear them ahead of lambing. That's going to stay drier in those pens. It's going to be more visible to you if a ewe is having difficulty lambing, or if a ewe is having any off-colored discharge. They're going to stay cleaner, so the lambs are going to be suckling on cleaner teats. The ewes will have a higher metabolic rate, so they'll have less problems with ketosis. They'll be usually seeking a warmer place to lamb than if they had all their wool on. If the ewes are jugged, then they're going to feel their lambs if they happen to lay down on their lamb, which any healthy ewe shouldn't be doing. And you can put more sheep in that barn because they take up a lot less space with all this wool off. So now let's look at some problems with baby lambs. Why do the lambs sometimes look cold in the morning or act cold? So this is a lamb that's obviously it's born, and it doesn't get up and stretch. If you pick it up, it still doesn't stretch. It doesn't go find the teat. It just looks humped up. It doesn't look energetic. It looks kind of dull. So it could be that this was a newborn lamb overnight and it's just really cold in your barn. Maybe there's too much of a draft where that lamb was. Or it could be a 2 to 7 day old lamb that just isn't getting enough calories. It's not getting enough milk for the temperature that the lamb's in. And so why would this be? It could be that it's a bad mother. So she doesn't have good maternal instinct, in which case, however you wish to take note of that, I would encourage you to take note of that and get rid of that ewe ahead of your next lambing. Maybe the lamb got penned with the wrong mother. Maybe there's milk production problems with that ewe, so she's got 3 lambs but only 1 teat that's functioning. So that's a similar problem as if she's got 3 or 4 lambs and not enough milk for those. Maybe this is a week-old lamb and you turned it out of the jug and it was in the mixing pens, but your mixing pens had partitions that could leak lambs, and so the families got mixed up, but you didn't realize that. And so this lamb had been 2-3 days of crying, trying to tell us that it wasn't in the right place, and the colder and hungrier it gets, the less crying it does. And we didn't realize it, and all we do is find a lamb that can't get up and has got a temp that is probably about 88 to 90 degrees. So how can we avoid this from happening besides fixing the panels in between our mixing pens, which can easily be done with just quick zip tying snow fence up, but just using paint brands and kind of at feeding time paying attention that all the numbers match up how they should. Okay. Again, regardless of whether we lamb in confinement or if we lamb out on grass, it's very important about udder shape, size, teat shape, size, and particularly placement. So this teat projects a little bit out toward the lamb. That's nice for a baby lamb because it's going to bump into this teat as it's looking for the teat. It's a small teat, so it fits in the lamb's mouth nicely. It's about a darn near perfect teat, to be honest. If there's plenty of colostrum and in milk, then when that lamb latches on, a lot of those ewes will have a letdown and milk will start flowing into that mouth, triggering its olfactory reflexes to keep suckling. This isn't pretty clean looking. I changed the photo a little bit so that she doesn't quite look normal colored, but everything right here is pretty clean looking. Okay. And then we all have friends who are new to raising sheep and goats, and they're nervous about how to give extra milk to a lamb that maybe isn't strong enough to suckle out of a nipple. So I'm kind of opinionated. I don't know if this is going to play. That we use. I like clear stomach tubes. I throw them away at the end of lambing before the next lambing season starts because I'm pretty sure I can't sanitize them adequately. They're really cheap. We all can practice tubing dead lambs so that we know how to do it when they're live lambs. And then there's definitely certain ways that we can make this easier on ourselves and easier on the lamb. And this video may not play. Sure enough, a little technological problem. So I'll need to figure out how to get out of there. Sorry. But I tried to borrow this video from Premier One Sheep Supply because it was a live video and I thought it was really helpful. So you'll just have to go to their website and find it yourself. Sorry about that. And now, I guess this is what happens when you break copyright rules. You get penalized. Here's our friend who's passed now, Dr. Jerry Kennedy, and he's showing the way that he and I also prefer to hold lambs to stomach tube them. So we just gently hold them in between our legs. That way we have both hands free. And we start passing the tube down the lamb's mouth. And then I'll be honest, I can put my hands right here on the neck. I put my fingers on each side of the neck and I can feel the stomach tube going down in the lamb. Even though we will lamb over 1,000 ewes a year, I still, on all the tubings that I do, put my fingers on either side of the neck and feel for that tube going past my fingers. Why do I do that? Because that's my insurance that I know that the tube has gone in the esophagus, which it does about 99.9% of the time. But in the 2 lambs that I've drowned and accidentally tubed into the trachea, which is pretty difficult to do, to be honest, you feel awful because basically you just gave them the death sentence. So still holding this lamb between your legs, then we just pour the milk in. And how much are you going to give? It's going to depend on the size of lamb that you have and how vigorous it is. So if I just want to give a lamb a little help to help it be more energetic with its mother and keep it bonded to its mother, I might only give it 4 ounces. If I have a lamb that is a bigger lamb, let's say it's a 14-pound lamb, I'm definitely going to give it 8 ounces. Just kind of depends lamb to lamb. So somewhere, if I had a little Nigerian dwarf goat kid, I'm probably only giving it at the most 1 ounce. So it really depends on the size of the lamb. Now, talking a little bit more about how to treat these cold lambs, let's focus on this side first. So this lamb has already been old enough to have colostrum. We hope it has. And we find it cold. So its temp is in the mid to lower 90s, maybe even the 80s if you have a thermometer that goes that low, but they do make those now. It can't hold its head up. It can't swallow. And so this lamb needs to be given some way to make some dextrose in its own body. So we're going to give it intraperitoneal dextrose. I'll show you a picture in the next slide. And we're going to put it in a warm environment. And so some of us build fancy lamb warming boxes. Some of us build less fancy ones. For instance, just taking about a 2.5 foot by 2.5 foot cardboard box, cutting a circular hole in it and sticking a hairdryer in there, and putting the lamb in this box sealed up and run the hairdryer full bore. I like to have that set up where I can kind of pay attention that we don't start a fire, but definitely I'll get that temperature in that box up to about 100 degrees. And in about between an hour and an hour and a half, that lamb will start coming back to life. Now, mind you, I've already given it the intraperitoneal dextrose, and now I'm giving it the warm environment, not the other way around, okay? What about a baby lamb just born in the last 24 hours and we find it cold? That lamb only needs some extra warming up. It's got enough brown fat internally that it can use that to make its own glucose, I should be saying, and then they'll use that glucose to help warm itself up with the help of the warmer environment. And once that lamb is coming back to life and can hold its head up, you can go ahead and tube it with colostrum or milk. Okay, so here's a picture I'm trying to show you of how to give the intraperitoneal dextrose. So first, let's talk about how to make that intraperitoneal dextrose. We take a brand new bottle of dextrose. It should cost you somewhere around $5 to buy this 250 ml bottle of dextrose. Brand new, so I haven't accidentally inoculated any barn bacteria in there, which if they're growing in that bottle, you would know because you'd see these little cloudy, looks like snowflakes that if you shake the bottle, they're floating in there. I would take a 60 ml syringe and I draw up 20 mils of this 50% dextrose using a brand new needle. And then you take some boiled water and you draw up 30 mils of this boiled water in the same syringe. So now you have 50 mils in the same syringe. And so my hand is relatively small. And so that's about the length of how far I can actually hold the syringe and push the plunger. So I don't fill it quite to 60 mils. Okay, I've got this now. This solution's right around 100 degrees. The solution is now gone from 50% to 20% with that dilution that I just did. And I'm holding the lamb. I can hold it by its front legs. And I'm pushing it back against me to kind of keep it still, but it is kind of really a wet noodle lamb. And then I have the umbilicus here, and I'm just going off to the side of the umbilicus and pointing my needle. We'll bring this whole syringe and needle up to here and pop it in. I use a 1-inch needle and I'm sort of pointing toward the opposite hip. And then I just give that all into the belly cavity of the lamb. It's not in the stomach, it's just free in the belly cavity. And all the little tiny blood vessels, all the little capillaries pick up this dextrose, and then I put this lamb in the warm 100 degree environment and warm it up and bring it back to life. And then I need to decide, why was this lamb hypothermic or cold to start with, and make some changes to address that so I can keep this lamb alive. Okay, I have this in here twice. I think mostly to remind me that I usually use a 20 gauge 1-inch needle. It's a brand new needle. I think those are costing me about between $8 and $10 for a box of 100. So my lamb is potentially already worth more than that. And then just to reinforce about this bottle of brand new dextrose, and making sure that I didn't accidentally put bacteria in there. If I don't throw this bottle of dextrose out during lambing. I just keep it clean. I keep checking for these little cloudy floaters. But then when lambing's all done, if I didn't need to use the whole bottle, then I'm going to throw the bottle out and replace it ahead of lambing again. Okay, I mentioned this earlier, but this is what I'd call a large teat. This is definitely, you can appreciate how large this teat is. Yes, she's a good milk producer, but this is kind of a big teat for lambs being born on pasture. This is a surviving 2 lambs in a family of triplets. See, they have the little dot there. And you can see that, to me, neither one of those lambs looks normal. why. Like this lamb's dehydrated, see, you can see some wrinkles there. I can just start to see the ridge of its back because it's been losing weight. This lamb is starting to be cold from starving to death. I can tell it's dehydrated too. And this is May, so we shouldn't have issues. But we do because it's not been getting enough to drink. Some people are just naturally good at picking up problems early on. Some people don't see them as readily. Certainly in these larger litter, lower birth weight lambs, like these are pretty little lambs. Granted, she's a little ewe, but lower birth weight lambs are likely to have more problems, and so they're going to need some extra TLC to keep them going. Once they're a couple days old and thriving, they should do just fine, other than maybe never reaching a market weight size that's good for commodity trade, but it definitely would be potentially be a good ethnic market lamb. Okay, how much colostrum do lambs need in their first day of life? And this is adapted from a table from, I believe, from Practical Lambing, a book out of England that's really good for beginners and people like me who need refreshers sometimes. So it just shows you the difference between lambs born inside, lambs born outside, where there's wind and rain, and also gives us a good appreciation. Let's pick this, the 9-pound lamb, that it needs 24 ounces or 720 mils of colostrum in the first day of life. That's a lot for your 160, 170 pound ewes to produce, especially when they have 2 or 3 lambs. But with good management, these ewes can do that. Okay, so this is just basically showing that if you break it up into 3 feedings a day, and we can't control that when the lambs are left on the ewes, on how much they need to drink each time. Okay, what could we use to substitute for ewe colostrum in families where we don't think we have enough colostrum? We could go to a goat dairy and ask if we can have or buy goat colostrum. It's nice if we were to heat treat that colostrum where we kept the immunoglobulins or the immune proteins active, but we destroyed any bad bacteria or any cryptosporidia. The same true on cow colostrum, but the one other organism that's fairly common in some dairy herds is a bacteria called Mycobacterium paratuberculosis, or the disease is called Johne's, and we don't want to import cow Johne's disease into sheep flock because it will take hold and cause infection. Now, one thing about cow colostrum compared to sheep or goat colostrum is cow colostrum is not as calorie dense. And so we need to feed more volume, 20 to 40% more volume, to meet the caloric needs of those lambs. And here's a list of organisms that we could bring in with colostrum from other farms. And so many of us now reach for powdered colostrum substitutes. And not all of them are the same quality. So if you're using one and it's working really well, then I'd say, yeah, you should stick with that. If you're using one and you're still having sick little lambs or sick little kids, then I'd be looking for making a change. And so I'm not doing a commercial here. It's just that a couple of years ago, I made this slide with this product. This product at that time did have a lot of immunoglobulins in it. Yes, they were geared toward cattle, but we didn't necessarily have a good sheep or goat one. Now there's some better, there's some other products out there that are still made out of cow colostrum, but have a sheep or a goat label. And so just be critical. And it is an example where you get what you pay for. So if you think that this bag is expensive, because it's going to cost you a little over $20, realizing that sometimes quality costs more. Okay. What kind of problems do we expect at lambing time? Well, we may have problems with the lambs being born. For us in pasture lambing, our worst nightmare are two lambs trying to be born at the same time and us not realizing it, because that is a good killer of ewes. And it sometimes can be hard to tell out on pasture unless you go by and look at that pasture a couple times a day. It's not a common thing, but it does happen. What other problems? Again, lambs that get cold, either because the environment was not nice, big rainstorm that went on for 3 days. Usually we get wind with rain, or we had starving lambs that were cold secondarily to starvation. Starvation, person can see pneumonia in baby lambs. Sometimes pneumonia is a secondary event of a lamb being deficient in vitamin E and selenium. And that's why I put white muscle disease up there. And that's just another reason I would emphasize that the pregnant ewes ration, whether that's green forage or whether that's a harvested feed, is well balanced with extra vitamin E and selenium. Other problems, we can have inverted lower eyelids called entropion. Going back to 3 days worth of rain on pasture lambing, we can see infections that probably start by going in the where the umbilical cord is trying to dry up and going by way of the bloodstream to the joints. Usually it's the knee joints or the stifle joints. And sometimes we can see tail dock infections, and those, in my experience, are most commonly related to where an environment really just needs to be cleaned out and rebedded. Several years ago, this hand pump started to be marketed, and I thought it was a great thing because I'm not the greatest ewe milker. Sometimes when we get further into lambing and I'm a little tired, I don't have the most amount of patience. And I think this is a good tool, but I think we also have to be careful to not be overly aggressive with this pump, because we could potentially cause teat damage and maybe a secondary mastitis form because of it. Milk production problems. Certainly we can have not enough milk being produced if we have a virus called the ovine progressive pneumonia virus, or OPP, infecting the ewe, in which case we get a lot of inflammatory cells equally infiltrating both halves of the udder and causing a reduction in milk production. So that's one possibility. We could have not enough protein in the diet. Milk production is very responsive to the right levels of milk production in the diet. So pretty much any forage growing in Minnesota in the first 3 weeks of May is going to be very rich in protein and not an issue. But if we were using harvested feeds, our goal would be somewhere around 15 to 16% milk production on ewes raising twins or more. There's been a hypothesis around for many decades about too much protein can cause hard mammary glands. I personally have yet to see that proven. And then certainly I talked about it before, but selection can be helpful with making sure we have adequate milk production. So ewes that don't milk well, maybe they need to get wheels under them and go to the sale barn, or be used as lawnmowers somewhere other than in your flock where you're trying to raise lambs. This is a ewe that has hard bag from the OPP virus. So that udder looks normal. It feels firm when we go and feel it with our hands, and there's just not very darn much milk coming out of either teat. If a ewe had a bacterial mastitis, not a OPP virus infection, then the questions that I get asked is, did it develop when she was during her last lambing, or did it develop after weaning, or did it develop, and this happens in some of my ewes, in the week or two before she lambs? And like it happens in my ewes because I keep them in a dry lot for my April lambing group, and I can't control the amount of moisture and I should try to figure out somewhere to keep them drier if it starts raining. But I know that those ewes that when I ultrasound them and I bagged them, they were normal, and yet I have a few cases of active mastitis when they lamb. And so I think those happen in the week or two ahead of lambing. The bacteria that a person cultures may not be the same as the bacteria that caused the initial infection. It really depends how long the infection has been present, whether you've got some chronic bacteria or you've got what the initial cause was. And in my hands, I try to treat them, but I am not always successful at getting them to be 100% effective milk producers again. There's some new things coming out. Certainly, just want to make you aware that there's a vaccine soon to be marketed. It's a European vaccine, initially developed and used in some European countries, used for sheep and goats both. In the US, it will only have a goat label, but there is data to support its use in sheep in other countries. And then this right here is just an example of a barrier teat tip that I use sometimes on ewes at weaning to try to keep those teats sealed and protected from wet environments. These are two little lambs that were dead at the same farm on the same day. And this is just an example of starvation and some pneumonia. So this is a lamb that has nice normal lungs. It has lots of fat over its heart. It has lots of fat over its kidneys. It has a stomach full of what would be clotted milk. Its intestines are not full of milk though. So these intestines should not be green. They should all look like this, like they have digested milk. And so this lamb most likely died of an acute hypothermia. This lamb, on the other hand, has a lot of problems. So here's its heart, and all its tan, hard fat has been used, and now it's kind of gotten light purple and more gelatinous. You have to take my word for that. Here's its kidneys with no fat around them at all compared to this kidney here that's covered in that tan, hard fat. And then there's some degree of pneumonia right here. So this lamb had a number of problems. Can you all make those diagnoses with some experience and some good teaching or instruction? It can be done. I have some clients who FaceTime me when they open something up, but we have to work together so that we all learn what normal anatomy is. So if I say, oh, well, what was in this structure? What was, let me see the kidneys, we know what we're looking for. Certainly, it's easy to throw these guys in a trash bag and drop them off at your local vet clinic, and they can unzip them pretty quick in between appointments and give you some good information back. So what are the subtleties of sick lambs? I mentioned this, that when they get up, when they wake up, they get up and stretch, and then they start nursing. Its ears in normal position. So here's a little Suffolk lamb that, yeah, I can't help that this ear's a little droopy because it has an ear tag, but this lamb looks bright and alert. Does its belly look and feel full? They do have a certain shininess to their eyes, and they are paying attention to their environment versus looking dull. The thermometer is definitely your friend and should be used in any lamb or any ewe in the first week after lambing that looks not right. You'd be amazed. You could have a ewe that had lambed 3 days ago. She didn't eat well in the morning, and you find, whoa, my goodness, she has 106 temp instead of her temp should be at, normally between 102 to 103. And that ewe could just have a problem starting with a uterine infection, or maybe she has a mastitis, but in any event, it shouldn't be ignored. So when you go through and look at your group of ewes and baby lambs, look at least twice a day. I mentioned about using a thermometer. It's helpful if your ewes have ear tags, so it's easy to keep track of the details. And in spite of what some of the books say, I'm just going to suggest to you that the normal temp of a sheep is always 103, unless you had to run a half marathon to catch it. Okay, I've mentioned pretty much everything on this slide with the exception of just another helpful hint. If you like to dip umbilicuses of baby lambs when they're born, using 50% rubbing alcohol and 50% tincture of iodine is the best drying solution that you can possibly use. It's getting a little harder to find rubbing or ethyl alcohol, but it's still there. And this dries much better than anything else I've ever used. Okay, so here's a friend of mine just docking his lambs, putting in electronic ear tags. This is his handheld computer, so he can record that this ewe had what she had for a family, and then he docks this handheld computer to his desktop, and his records are right there, ready. No more, copying things or typing things over. This is just a little lamb with tetanus. You can see it looks like it could be real stiff. Antitoxin is something we use for treatment. It's not always available anymore. Some of the regulations that were required in its manufacturing changed, and it made it more difficult to make. And so plan ahead. If you think you need to have antitoxin on hand, don't buy it at the last second because it may be on back order. And remember that the baby lambs get protection against tetanus when they're born to ewes that were vaccinated against tetanus in the last month of pregnancy, and those ewes made good quality colostrum, and the lambs got colostrum. Here's pictures of lambs with entropion. So you can see the first sign is a wet cheek from tearing. Here's more tearing. And the longer this lower eyelid rubs on the cornea, on the surface of the eye, then we get this ulcer forming. This lamb, see that grayness there? That's an ulcer. And this is very painful for these lambs, and they will not thrive. They'll stay alive, but they won't thrive. And so there are lots of farm-friendly producer methods of fixing those. Just to kind of go through them real quickly before we totally run out of time. You could actually just take a paper towel, dry this eyelid, pull the lower eyelid back into the right shape, and take about a cc and a half of penicillin and inject it under the skin right here, and make a big bleb that pulls this eyelid down in position. Most common thing people use are these wound staples, and you just take a special little pliers that comes with them. And again, you basically are pulling this skin back into position, and we pull this eyelid off of rubbing on the eye. Some people ask me, should we put the staples horizontal position, or should we put them vertical? And really the answer is either one will work. And then lastly, we could put some stitches in here that did the same thing as the staples or the bleb of penicillin. Or we could even just use a scissors and cut a little snip of skin out of there, and that will take care of the problem too. Most of us really prefer these wound staples. They work quite well. Okay, things that we want to have at lambing time right before we wrap it up. Is make sure we have enough jugs, at least 10% of the number of ewes that are going to lamb. Make sure we have brand new stomach tubes, at least 2, because if it's like our house, we sometimes lose one. Have some colostrum supplement or frozen colostrum ready. A thermometer, at least 2. You might want to have a scale if you're curious what your lambs weigh. Ear tags, paint branding paint. That's the handheld teat pump or udder pump, and decide how you're going to keep records. This is just, I thought, a beautiful picture from my friend Janet McNally. Just wondering if you want to email me questions, this is how you'll find me. Thank you very much.